what that does is just we simply mounted that echo probe on a catheter that goes inside the heart. So it's simply imaging inside out versus outside in of cardiac structure. Intracardiac echo, or ICE, has been around for a long time, but it has been almost exclusively two-dimensional. So just in the last few years, we're started seeing some technology that is allowing 3D and 4D imaging, but the initial technology was very limited, and now this new technology is really a game changer in seeing the heart in four dimensions during interventions. The tricuspid valve is not imaged well with our current imaging modalities, with the traditional echo. So this certainly would allow us to see that valve in a much better way than we had been used to. And also, it would allow us to do, the second advantage, which is the minimally invasive procedures. Now, transesophageal echo does allow us to see very good imaging during most of our interventions, not all, but most. But it is more invasive. So this approach would allow us to see comparable images, but still do the procedure in a quicker time with shorter recovery and less exposure to anesthesia for the patients. What I'm excited about this technology is that it would really allow us to do a lot of the interventions we do now with general anesthesia, but in a more minimally invasive fashion without general anesthesia. And I could speculate that in 5 to 10 years, that could become the predominant way of guiding interventions, and we're very excited to be the first to use that technology here and to be on the forefront of streamlining the process and maybe showing how to do for other physicians and who are interested in the technology.